morning. Today we will learn about pain assessment in physical and functional diagnosis. Pain assessment. In this, we will learn about definition of pain, objective of pain assessment, nature of pain, and how we will assess the pain. Definition. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Objective of pain assessment are they are characterized the pain to know what is the pathophysiology of the pain, evaluate physical and psychosocial status that affect the patient due to pain, assess degree and nature of disability, develop a therapeutic strategy for treatment of pain. Nature of pain. Pain is subjective and highly individualized. Its stimulus is physical or mental in nature. Only the patient knows whether pain is present and how the experience feels. It may not be directly proportional to amount of tissue injury, but it is according to patient perception. For assessing the pain, we should know type of pain, location of pain, whether pain is progressive or non-progressive, distribution of pain, diurnal variation of pain, quality of pain, modifying factor of pain, and how we can measure and document the pain assessment. Now, which are the different type of pain? Pain is classified based on pain physiology, intensity, time course, tissue involved, syndromes, and spatial consideration. Now, according to pain physiology, that means how the physiology has caused pain. Pain can be nociceptive pain, neuropathic pain, or inflammatory pain. Now, what is nociceptive pain? Nociceptive pain is experienced when an intact, properly functioning nervous system sends signals that tissues are damaged, requiring attention and proper care. For example, when pain is experienced following a cut or broken bone, alerts the person to avoid further damage until it is properly healed. Once stabilized or healed, the pain goes away. Now, nociceptive pain is again divided into somatic pain and visceral pain. Somatic pain is the pain that is originating from the skin, muscles, bone, or connective tissue. The sharp sensation of a paper cut or aching of a sprained ankle are most common example of somatic pain. Somatic pain are well localized and they can be described as sharp, aching, or throbbing type of pain. Visceral pain. Visceral pain is pain that results from activation of nociceptors of the thoracic, pelvic, or abdominal visceral organs. They are characterized by cramping, throbbing, pressing, or aching quality, and they are more diffuse. Example of visceral pain are labor pain, angina pectoris, or irritable bowel. Neuropathic pain. Neuropathic pain is associated with damaged or malfunctioning nerves or nervous system due to illness, injury, or undetermined reasons. Examples are diabetic peripheral neuropathy, spinal cord pain, phantom limb pain. Neuropathic pain. It is usually chronic. It is described as burning, electric shock, or tingling, dull, and aching type of pain. Neuropathic pain tends to be difficult to treat. Neuropathic pain is of two types based on which part of the nervous system is damaged: peripheral neuropathic pain and central neuropathic pain. Peripheral neuropathic pain due to damage to peripheral nervous system, example phantom limb pain, and central neuropathic pain results from malfunctioning nerves in the central nervous system, like in spinal cord injury or post-stroke pain. Inflammatory pain is caused by tissue inflammation, like thrombolic type of pain, and most commonly seen in acute condition. Intensity can be mild pain, moderate pain, and severe pain. And according to pain scale, if pain scale reading is 1 to 3, that pain is considered as mild pain. If pain scale reading is from 4 to 6, it is considered as moderate pain. If pain scale reading from 7 to 10, it is considered as severe pain. Time course of pain. Time course of pain can be 3 months for acute condition, 3 to 6 months for subacute condition, and more than 6 months for chronic condition. This classification is used for osteoarthritis or RA-like condition. 7 to 10 days acute conditions, 10 days to 7 weeks subacute, and more than 7 week chronic condition. This classification is used for soft tissue injury like ligament injury or muscle injury or other soft tissue injury. Acute pain. When pain lasts only through the expected recovery period, it is described as acute pain. Acute pain is protective, has an identifiable cause, is of short duration, and has limited tissue damage and emotional response. It eventually resolves with or without treatment after an injured area heals. Unrelieved acute pain can progress to chronic pain. Chronic pain. Chronic pain is the pain that lasts longer than 6 months and is constant or recurring with a mild to severe intensity. It does not always have an identifiable cause and can lead to great personal suffering. Examples are arthritic pain, headache, peripheral neuropathy. The possible unknown cause of chronic pain combined with unrelenting nature and uncertainty of its duration frustrate a patient, frequently leading to psychological depression and even suicide. Associated symptoms of chronic pain include fatigue, insomnia, anorexia, weight loss, hopelessness, and anger. Now, pain can be divided according to tissue involved. The structure involved have different type of pain. Like for muscle injury, there is cramping, dull aching pain. For ligament joint capsule, dull aching pain. For nerve root, sharp shooting pain. For nerve, sharp bright lightning like pain. For sympathetic nerve, burning pressure like stinging aching pain. For bone pathology, deep nagging dull ache pain. For fracture bone, sharp, severe, intolerable pain. For vasculature injury, throbbing, diffuse pain. Now syndromes. According to syndrome, there are different type of pain which cannot be categorized in these type of pain, like cancer, fibromyalgia, migraine. So they are considered in different classification. Special consideration: For specific pain like psychological pain, because of anxiety and coping style, patient have pain in different part of body or particular part of body that is not related to pathophysiology, so that is considered in special consideration. Age related pain, because of age there are many degenerative condition in body that can lead to pain. So older adults have a greater likelihood of developing pathological condition which are accompanied by pain. Gender, menstrual pain in female is most common. Now location of pain. For locating pain, we use body chart to indicate area of pain and take notes on description such as burning or aching. Localized, common in acute condition, and generalized, common in chronic condition. Also, we are identifying trigger points. Trigger point is a sensitive area in muscle or connective tissue or fascia that become painful when compressed. It may be accompanied by tight band and may referred pain can be deep and aching. This is body chart of anterior and posterior body. In here, this chart, deep sharp anterior shoulder pain is marked with blue dot. Area which is not painful, arctic and radiating pain is also shown. Now progressive and non-progressive pain. Is pain progressing? That means whether it is increasing, that indicate condition is worsening. Is it non-progressive? That means if condition is same or no effect of treatment. If pain is decreasing or reducing, that means condition is getting better and your treatment is effective. Distribution. Condition affecting any other joint or body tissue, whether pain is localized or whether it is distributed in different body part or joint. Diurnal variation, that means whether pain changes with temperature. For example, in arthritic condition, pain is more during early morning, as in early morning temperature is colder, and as day pass by the temperature become warmer and pain reduces. Now quality of pain is also according to structure involved, as we have seen. When whether vessel is involved, patient will have cramping, dull aching pain. Ligament joint capsule is involved, patient will have dull aching pain. Nerve root is involved, patient have sharp shooting pain. When nerve is involved, sharp bright lightning like pain. Sympathetic nerve is involved, burning pressure like stinging aching. When there is bone pathology, deep nagging dull pain. When fracture of bone occur, there will be sharp, severe, intolerable pain. When vasculatures like artery or vessels are involved, there will be throbbing and diffuse type of pain. Now there are different modifying factor of pain, like aggravating factor that increases pain. Example are during joint movement, pain increasing, or particular posture is giving more pain, or any activity is increasing pain. Also there are relieving factor that decreases the pain. Example, any resting position or posture or any medication that is relieving pain are considered in this. Measurement and documentation. By pain rating scale and questionnaire, we are measuring and documenting the pain assessment. For this, we are using pain rating scale. For selecting pain rating scale, scale should be suitable for the patient ability, age and preference. Teach patient to use scale before pain is expected, such as preoperatively. Use same scale with the patient each time pain is assessed. There are different type of pain rating scale: single dimensional scale or multi-dimensional scale. Single dimension scale means it assess only one dimension of pain like intensity. Multi-dimensional scale means it assess different dimension of pain like intensity, quality, type, modifying factor, etc. In single dimensional scale, example are visual analog score, numerical rating scale, verbal descriptive scale, temperature scale, and in multi-dimensional scale, McGill pain questionnaire. Now we will see individual scales. Visual analog scale, or also known as VAS scale, is most commonly a straight 100 mm or 10 cm line without demarcation. It has the words no pain at the leftmost end and worst pain imaginable or something similar at the rightmost end. Benefit of VAS is that it has been validated and shown to be sensitive to changes in a patient's pain experience. It is quick to use and relatively easy to understand for most patients. It avoids the imprecise use of descriptive word to describe pain and allow a meaningful comparison of measurement over time. As we can see, here is 10 centimeter pain scale. We have to ask patient to mark the line where he feels his pain most probably relate. Now, disadvantages of VAS scale is that it attempts to assign a single value to a complex and multi-dimensional experience. Some patients have trouble deciding how to represent their pain sensation. They often have no real concept of what worst pain imaginable actually means because every experience of pain is different. It has a false ceiling at the uppermost end. If a patient later time decide that the pain has become worse, the patient has no way to document these changes if it was already at maximum. Second scale is verbal descriptive scale. The verbal descriptive scale is a list of words ordered in terms of severity from least to most that describe the amount of pain that a patient may be experiencing. Patients are asked to either circle or state the word that best describe their pain intensity at that moment in time. The benefit of verbal descriptive scale instruments are that they have been validated and are simple for patient to understand and quick to use. It have different terms for identifying the pain like no pain, mild pain, moderate pain, severe pain, very severe pain, and worst pain possible. The disadvantage of VDS forces patient to select words that are not of their own choosing to describe their pain. Changes in pain over time are difficult to interpret and probably have different meaning to each individual. This may especially be a problem with the verbal descriptive scale when only a limited number of possible choices are offered to the patient. That is, only 4 to 6 words are given to describe their pain. Another scale is numerical rating pain scale. The numerical rating scale offers the individual in pain to rate their pain score. It is designed to use by those over age of 9. In the numerical scale, the user has the option to verbally rate their scale from 0 to 10 or to place a mark on a line indicating their level of pain. Here, 0 indicates the absence of pain, that means none pain is present, while 10 represent the most intense pain possible. 1 to 3 indicate mild pain, 4, 5, 6 indicate moderate pain, 7, 8, 9 and 10 indicate severe pain. Other pain scale is Wong-Baker face pain scale. The Wong-Baker face pain scale combines pictures and number to allow pain to be rated by the user. It can be used in children over the age of 3 and in adult also. The faces ranges from a smiling face to a sad crying face. Numerical rating is assigned for each face, of which there are 6 total, like 0 no hurt, 1 hurt little bit, 2 hurt little more, 3 hurt even more, 4 hurt whole lot, 5 hurt worst. Also 0 no hurt is 0, 1 is indicated 2 for identifying pain intensity, 2 is identified as 4, 3 is identified as 6 intensity and fourth is identified 8 intensity and 5 face is identified as 10 intensity. Other pain rating scale is thermometer pain rating scale. It is a thermometer with various grade of pain on it from no pain at all to the pain almost unbearable. We have to put an X by the word that describe your pain at the best. There now we will see McGill pain questionnaire, that is a multi-dimensional pain scale. The McGill pain questionnaire consists of grouping of words that describe pain. Once the person has rated their pain word, the administrators assign a numerical score. And according to that numerical score, we will interpret the amount of pain patient have. If patient have 0, that is minimum pain score, that means person do not have true pain. Maximum scoring will be 78, that means person have greater pain. Also, the higher the pain score, the greater will be the pain. In McGill pain questionnaire, we have different group of words. In this, group 1 to 10 describe sensory type of pain. Group 11 to 15 describe affective type of pain. Group 16 describe evaluative pain. Group 17 to 20 describe miscellaneous word for different syndrome or special consideration in scoring process. This is pain questionnaire, McGill-Melzack pain questionnaire. In this, we will take demographic data. Also, we will take whether patient is having any medication or not, as that can also modify the pain. Also, we have to ask patient for few questions. Where is your pain? What does it feel like? How does it change with time? How strong it is? This is body chart. In this, we have to ask patient to mark joint or area of body where pain is indicated. For internal pain like joint pain, patient have to indicate I, that is inside pain, and for external pain, patient have to indicate that point with E, that is external pain. What does your pain feel like? So this is different words that will describe your pain. So in different group, words are given. How does your pain changes with time? Whether it is continuous, steady, constant, whether it is rhythmic, periodic, intermittent, or whether it is brief, momentarily, or transient. What kind of thing relieve your pain? So we have to identify the modifying factor. Also, what kind of thing increases your pain? How strong is your pain? So to identify the intensity of pain, we have to ask patient to choose a word for identifying intensity of the pain. Mild pain, discomforting pain, distressing pain, horrible pain, or excruciating pain. Also, to compare the pain and identify the pain, we have to ask patient few questions that are: which word describe your pain right now? Which word describe it at its worst? Which word describe it when it is least? Which word describe the worst toothache you ever had, to compare the present pain? Also, which word describe the worst headache you ever had? Which word describe the worst stomachache you ever had? So, from this 5 word, patient will write down which type of pain in different condition patient will have. Now, as we have seen, McGill pain questionnaire is very long, so it is time consuming. So for that, we are using a short form McGill pain questionnaire. The short form of McGill pain questionnaire consists of 15 representative words that form the sensory item and affective item, 11 and 4 categories of the original MPQ. Each descriptive is ranked on a 0, none to 3, that is severe intensity scale. Also, the present pain condition, that is PPI, along with VAS scale are also included. So this is short form McGill pain questionnaire. In this, we can see on left side there are different words given for identifying the pain. Like throbbing like pain is none or mild or moderate or severe. Also, VAS scale is given for identifying the intensity, and also 5 words are given for identifying the pain or describing the pain. So that was all about pain assessment. At the end, the cure for pain is in the pain. So it is very important to assess the pain properly and then plan the treatment, as if you have not assessed the pain, you cannot completely treat the pain. Thank you.